this to the cloud.
Hi, my name is Breana Washington, and I'm going to be talking about health benefits for mom.
Hi, my name is Ashlea Wineland, and I'm going to be talking about health risks for mom and also health benefits for baby.
Hi, I'm Christine Coulter, and I'm going to be talking about the health risks to the baby. So, during emergent and life-saving situations, there's no denying the tremendous impact C-sections have on increasing the favorable outcomes for both mother and baby. Technology has come a long way and has made C-sections safer, leading to an uptick in the number of C-sections performed every year. According to the CDC, in 2016, 31.9% of all births were via C-section. With the increased safety, normalcy of C-sections, there is an increase of elective surgeries. For the purpose of our debate, an elective C-section is a C-section requested by the mother without any indication of distress to the mother or the baby pre-labor. The American College of Obstetricians and Gynecologists placed the number of C-sections requested by mother at 2.5% of all births. There is a concern that the routine nature of C-sections has led to a sense of safety and has dimmed the risk associated with major surgery for the mother and the baby. The other side of it is that it empowers the woman and the mother to have control of their body and the destiny of their pregnancy. It is our job now to share with you the benefits and the risks that we have found, and afterwards we invite you to discuss our thoughts and opinions that you have learned about what you've learned.
So some of the health benefits for the mother when electing to have a C-section, if she has a large baby or the baby is breech, having an elective C-section allows for the safety of the mom and the baby to whenever she's giving birth, to make sure that everyone involved is safe. The other thing about mom having a C-section is if she's having multiple. So if mom's having twins, this is better for her and better for her delivery and the health of both of the babies. Psychologically, like Christine said, with empowering mother, the biggest thing that I think with the benefits is that she gets to choose what's happening with her body. Let's say mom lives far away from the hospital or in a rural area. This allows her to decide what's going to happen, and say she has to go back to work pretty quickly. Although the C-section is going to take a little bit longer for her to recover, this just allows her to plan ahead, and especially if she's got young children at home or just other kids to take care of. Another thing that we've figured out is that as far as incontinence after birth, when you have deliver vaginally, you might have some complications, but with a C-section, it's less likely for there to be incontinence. And then again, like I said, we're just talking more about this is empowering the mother and getting to decide what happens with her body, and not, I guess, per se have whatever just happens naturally. She's getting to decide, and again, when electing to have a C-section, she just gets to take charge of the destiny of the birth.
Okay, so on the flip side, elective surgery of any kind actually increases a risk of infection, pain, trauma, complications, and even death. So especially on the side with the increased risk for infection, planned C-sections actually have 3 times the risk of infection than vaginal deliveries do. And that increased infection risk is also associated with things like increased labor time, membrane ruptures, and then the development of diabetes later on. Planned C-sections are actually not recommended for mothers who want to have more children. There's a substantial risk of things like placenta previa, which is where the placenta covers the cervix and it causes bleeding throughout the pregnancy. Placenta accreta, which is when the placenta is attached too deeply into the uterine wall and later can't become unattached. And then the increased risk of needing a hysterectomy later on, as well as blood clots. So they found that mothers who had planned C-sections actually had a harder time conceiving later on and overall had fewer children.
Okay, so whenever you're discussing post-op and all of those complications and the things that are happening. How do you feel about if she's going to, let's say she wants to go ahead and get like a tummy tuck after, how do you feel about just in general this empowering the mom to be able to kind of take control over her body, what it's going to look like after, all of that?
I think sometimes we have to take into consideration the factor of safety over that empowerment or that view of, how I'm going to look later, especially when surgery, it's unneeded. It's not necessary for what is happening at the moment. So when we can make sure that mom is more safe and baby is more safe, I think that takes precedence over being able to have a tummy tuck later on, or, being empowered to do that sort of thing. We're looking at the best interest for the client.
Right. Yeah, I know that that's been a big thing culturally with, in this day and age, that people are more concerned with what they're going to look like after and the complications. And I know some of that stuff is just part of the birth. But I do think that your stance on being concerned with how long mom's going to be recovering and all of that really makes sense. And I can agree that takes more precedence over the aftermath and what you're going to look like.
Yeah. I think my major question about your stance was that easing anxiety apart. So we talked about easing anxiety, knowing when we're going to have the baby, how we're going to have the baby, how it's going to happen, and establishing that plan. But I think the counter to that is anxiety over having major surgery, right? Being at least knocked out a little bit or anesthetized a little bit, and then being cut open. I think you give one anxiety, you take another. It just depends on, how they handle those sort of things. And I think if we're having more anxiety over delivering the baby and how we're going to deliver the baby, I think we're going to also substantially have anxiety over having major surgery and having your abdomen cut open.
Yeah. I personally can say I think that there's a lot of anxiety that comes with having a child just in general. And I've never had surgery of any kind. So I would say that I would be very anxious. And the other thing that comes with that too, I think, is that the doctor is really going to take a large portion of just discussing with mom, whether it's anxious about giving birth vaginally or giving birth as an elective C-section. The doctor's really playing a large role in easing all anxiety, and I think the family as well, whether she has a spouse or not. The other thing, though, that I also think, too, that we don't discuss is that regardless, there's going to be anxiety about when you're leaving, when you're going home with the baby, what that's going to look like if it's your first child, how that's going to go. There's so much anxiety. And so I think maybe having control of that one thing in the pregnancy might ease some mothers' minds, especially I know, like for myself, I like to have control over something. And so I know whenever I got induced, it was great just because I knew what was happening, when it was happening, what time of day and all of that. It wasn't an elective C-section, but I think that moms that maybe want to have control of something, that's something that they get to have control over, and it's their choice. So.
Okay, and I appreciate your pointing out, that need for control in your personal narrative for the process, which is awesome. But I do think that there are safer methods that we can go through, like you had said, induction, or just that education piece with the doctors, because when we, you had brought up that there's anxiety about when we can go home with the baby, how long you're going to be in the hospital, that major surgery means you're going to be in the hospital for longer. So.
Right. Yeah, for sure.
Okay, as far as the baby goes, there are definitely some risks involved with C-sections. One, there's delayed skin-to-skin contact, which is important. It regulates baby's warmth, the body warmth that they have, their blood sugar, their heart rate, their breathing. It all is pretty much tied to the skin-to-skin contact that they have with their mother afterwards. Also, it can delay the baby's ability to latch on during breastfeeding, which I think has been proven pretty well that it definitely helps the baby overall to at least get some breast milk at some point. Also, when the baby goes through the birth canal during a vaginal birth, it kind of preps the body's baby, or the baby's body, as they come into the world, and it kind of helps squeeze their lungs to get them ready for breathing, but also helps push the amniotic fluid out of their lungs. So a lot of babies born via C-section have fluid buildup in their lungs, and it can lead to transient tachypnea, which is increased breathing rate for a couple days after they're born, just because this fluid buildup in their body's having to work harder to get rid of it. Also, there's a risk of babies getting nicked during surgery, which, I mean, I don't think anyone wants their brand new baby getting cut up while they're, in there, even if it's a small one. It's like, oh. Also, there's a risk that when you schedule the C-section that you miss the due date and you actually now are delivering a preterm baby because you decided to have it come out early, which can have a whole risk of problems, including having to go into NICU as they finish developing, because that time period is pretty sensitive in there. There's also been studies that show that there's a possibility of a higher risk of diabetes, asthma, and obesity for the baby that are being born via C-section.
Okay, so on the other side, there are some health benefits for the baby to be delivered during an elective C-section. Our book does bring up the fact that a third of all births are C-section births, which means they're becoming more common, which means we have technology developing to know when we're able to take the baby out, how to do it the safest way for both mom and baby, right? So we reduce the risks of things like NICS, or, coming out to preterm, because, like Christine had said, every minute counts, right? When the baby's in there. So we know how far to take it. And then the elective C-section actually proactively addresses complications associated with vaginal delivery. This could be things like broken collarbones when baby is being delivered vaginally, injuries to the head and face when using forceps or the vacuum, and complications that can be later life-threatening, such as baby, deciding he wants to go breech, or having the umbilical cord wrapped around her neck. If we electively decide to take baby out through the C-section, I mean, we're avoiding any situation where baby could be breech, or baby does have the umbilical cord wrapped around their neck. Reducing things like, brain injuries and things of that nature.
Yeah. What is your thought on the skin-to-skin contact? I mean, obviously that's fairly important.
Yeah, it definitely is important. But I think sometimes when we think about, skin to skin and bonding, we don't take into consideration dad or partner of any sort. So, if we have an elective C-section and there's that delayed skin to skin, there's with mom, sometimes we can hand over to partner to go ahead and take care of that until mom is in a state that she's prepared to take the baby.
But the partner can't necessarily assist in the breastfeeding and the latching, which can be delayed. Right.
And so that's sometimes something we have to take into consideration too. Like, is mom planning on breastfeeding? Are we forcing that upon her? I mean, because that's also part of the empowerment piece, right? Giving her the choice to breastfeed, or giving her the choice to bottle feed, or whatever she may decide, which I think can be taken care of, that decision made prematurely, through the education pieces that the doctor would go over before, scheduling the elective C-section.
Yeah. And then the fluid buildup. I mean, obviously we want to protect a baby's lungs as much as we can, because breathing is it's an important part for everybody.
Right. So you bring up the fluid buildup and the breathing. I think that could be countered with, while that might be a risk, it's also a risk that baby has umbilical cord wrapped around their neck. And so that also would hinder breathing and oxygen getting to the brain. So I think with either one, there's a give and take. What's more, what are we trying to fight against? I feel like we have the technology that we can work to get the fluid out of the lungs, but sometimes when we've got the umbilical cord wrapped around the neck for too long, there's really no going back.
Yeah. I mean, either way, it's a tough thing.
Yes, it is. It is a tough decision for sure.
Well, in conclusion, as you've heard, there are a lot of risk involved and associated with giving birth, but moms get to choose what's going to happen. Planning a C-section may sound like a good idea if you anticipate complications, if you live in a remote area, like I said, or if you're anxious about the pains of labor, but it's important that expecting mothers are aware of the risk involved as well. Again, that goes back to discussion with doctors, with your family, etc. One thing to consider is the rapid development, like Christine said, of the baby, and cutting that time short if you do elect to have a C-section and you have the birth early. According to a webpage endorsed by the AAP, healthychildren.org, babies delivered at 37 weeks were twice as likely as those born at 39 to have complications. So that's another thing to consider, such as difficulty breathing, heart problems, and seizures. And that, again, requires time in the NICU and longer time for mom and baby to be in the hospital. Our team definitely has taken the against side. And while we understand that we do want to empower women, and at the end it is their choice ultimately, we felt that like there were a lot more complications involved and risks involved for mom and baby, and that's why we're taking the against side. So our question to you guys is consider, are we turning the natural event of birth into an act of convenience, or are we empowering women's right to choose? Thank you.